and thank you all so much.
Great. Thank you so much, Carly. Glad you can make it. And special thanks to the Washington Recovery Alliance for loaning you. We're all in this together, so it's wonderful that you could be a part of this. Well, welcome everyone, as I said, to the Mental Health Policy Roundtable. Just to let you know from the start, the Mental Health Policy Roundtable is an educational program to exchange ideas and transfer knowledge between seasoned leaders of the mental health policy field and newcomers. Founded in 1988 by myself, it remains a volunteer effort with free and public meetings. So welcome everyone. Very happy that we could have a roundtable focused on Washington State this time. So we have a really robust and interesting panel. I'm going to briefly introduce our panelists and then turn it over to David Wertheimer, who is our fearless moderator. Very excited that he could be a part of this meeting, as in addition to basically all the other roundtables that we've had stemming out of Washington State. And then we'll go into a discussion led by David, along with our speakers. And if it's okay, Carly, if you could let people in as you might see them, since you're co-host. Thank you so much, at least while I give this brief intro. Thank you so much. So I'm going to introduce our speakers very briefly. And just so you know, their brief bios are actually showing up on the flyers that were used to advertise today's event. Starting from the top, Tina Orwall, Senator Tina Orwall is a M.S.W, and she's a Washington State Senator, previously representative of Washington's 33rd Legislative District. She has 20 plus years experience in public behavioral health, workforce development, and affordable housing. I haven't seen Malika. Have you signed in, Malika? Okay, I haven't seen her yet. I might give her a quick text, but for now, when she gets here, her intro is Malika Lamont is a policy and advocacy leader focused on marginalized communities and the social context of health. She's experienced in teaching, program development, advocacy, research, and direct service. Joe Barsana, which we're very pleased to have with us today, is a Washington State certified peer counselor and recovery coach. He's a housing case manager for King County Drug Diversion Court and president and co-founder of Washington State Therapeutic Court Alumni Association. Welcome, Joe. We also have Dr. Amy Barden, who's chief of Seattle's care department, which is community assisted response and engagement, which directly works, direct work of 9/11 and community crisis responders. Dr. Barden has 20 plus years also in human services leadership. Welcome aboard. Thank you so much for being here, Amy. We have also Nick Federici, a professional advocate and lobbyist in Olympia since 1994. He has expertise in healthcare, human services, and affordable housing policy. And finally, our last speaker to bring up the rear is Cathy Murahashi. She's public policy specialist at the ARC of Washington State. Over 25 years of advocating for people with disabilities and their family. So once again, we have an excellent panel. Very excited to welcome them aboard and appreciate their time and expertise. David, would you like to launch right into the general theme for our session and then the dialogue?
Happy to do that. So, as you saw on the flyer, this is about protecting our communities.
in very uncertain times right now, given the current regime, shall I say, in Washington, D.C. And so we're going to have 4 questions we're going to look at and have our panelists respond to in the face of this increasingly hostile national political climate. So why don't we just dive in? So the first question is, given the current national political climate, what can we do here in Washington State to protect ourselves from the challenges that the president and his various appointees are creating for those who are among the most marginalized in our communities? Which of our panelists would like to go first?
David, I'm happy to join in. Tina Orwall, state senator from Washington, and honored to be here today. Thank you for the invite. It's a very important dialogue. These are uncertain times, and the harm and fear is real, and it's real in our state. We know a lot of families are struggling. I remember meeting with someone this last week who her 5-year-old is scared to play outside, scared a van's going to pull up or something's going to happen to the family. People being denied services or services removed. And I think our discussion today, I'd like to start with saying how proud I am of our state. Our state is standing strong. Our governor, our attorney general, our legislature, our courts, our media. And we have a lot of work ahead. I know we're going to talk about some of those pieces today, but I think my message is we're standing strong and that your voice matters. There is work, and I love the term you use, Laura, of collective, because it's going to take a team. It's going to take a team in our state, throughout the nation, but I do feel hopeful and look forward to talking about some of those strategies.
Thanks, Senator. Which of our panelists would like to go next?
If I might, David.
Sure.
Yeah, I think just piggybacking on what Senator Orwall said, I think being better, doing better, setting the example of what constructive governance and delivery of services, organizing, advocating, prioritizing, in some ways, deliberately prioritizing those folks that are being deprioritized at the federal level, right? Policies are, particularly budgetary policy, is a statement about who is important and who is not important. And so leaning into exactly serving those populations and protecting those populations that at the federal level are being stigmatized, attacked, and defunded, and deliberately leaning into being a leader in doing better, potentially even better than we've done before, to the extent that the funds are available and haven't been starved, to be able to serve those populations better and be a beacon of hope for other folks to show this is how America should be, and this is a state that that's a beacon of hope for others.
Thank you, Nick. Cathy.
Yeah, I think also we need to be thinking about, we know our civil rights are at risk from the federal level of just not being enforced. And we need to be thinking about, in Washington, how can we strengthen our own state laws to protect folks when things are not going well? And unfortunately, sometimes that costs money, to protect those. But we need to think about, where in our state law, whether it be, I think about the Olmstead law, that gives people the right to live in the community. If that's not being enforced at the federal level, what do we need to do in Washington to make sure that people still have that right to access to the community and other laws like that?
Good. Thank you, Cathy. And Joe, I saw you wanted to chat.
Sure, David. Everyone, thank you so much for having me. First off, as the resident peer support specialist, and I have to say, centering the lived experience and the voices of those who are marginalized and those who are vulnerable, I think they need a seat at the table so they can get access to the care, access to the protections that the state does offer. I think we really need to invest in those safe spaces for those folks so people feel like they have a safe space to go. Either that's recovery housing, permanent supportive housing, any protection that really allows the vulnerable, the unhoused to be protected. I think we need to double down and expand on that. Thank you.
Great. Any other thoughts from our panelists?
I can share a thought, David. I'm encouraging people to really focus local. There's a lot that we can control. I'm in Seattle, King County, Washington State. We have not done well with regard to mental health, behavioral health, homeless response for my entire lifetime, really. And so I'm trying to help people to not weaponize these issues, to not be too distracted. I like that there's advocacy happening at the federal level, but we really need to focus on our neighbors. I'm trying to redesign first response, right? Who do you send first to a 911 call? How do we integrate with 988? And then actually ensure that we're interrupting these cycles and helping people into a rehabilitative path rather than just triaging day over day.
Great. Thank you, Amy.
David, I'm sorry to interrupt. Just to let folks know, Malika should be on board, and we're on the kind of the first question, Malika. So just pick up as you wish to get engaged in our discussion. Thank you and welcome.
Yes, Malika, please share your thoughts.
Please repeat the question.
Yeah, the question is that given the current national political climate, what can we do here in Washington State to protect ourselves from the challenges that the president and his various appointees are creating for those who are among the most marginalized in our community?
I apologize for having my camera off, but I'm in a place that doesn't have particularly strong internet, and I won't be able to hear you or speak back if I turn my camera on.
Okay.
I think that really we need to be. I appreciate what Amy has mentioned about how we can integrate our systems from a state level, but I think that we also need to make sure that we are doing things at the hyper-local level and throughout our communities, and also finding people that are of like-minded approach because it differs so much across the state, the whether or not folks are in support of some of these policies and or if they are not. And I think that we need to be honest about that can make people potentially vulnerable, more vulnerable, depending on what the local ethos is to the policies that are being implemented from the federal level. So from a hyper-local approach, I think that we need to make sure, in a community-based approach, we need to be thinking about how we create systems of care and support for our neighbors within our community. And if we can get support from local government, all the better. However, I think that we are entering a phase where we cannot expect the degrees of investment and help that maybe we have had from formal structures in the past.
Thank you. So let's move on to the second question. Given your own specific and varied roles, how are each of you personally responding to the challenges we currently face at the national level?
David, I'm happy to jump in and talk a little bit about the state level. I really appreciate the comments that have been made. I know Amy mentioned some of this. You know, I just got off the 988 jam. We've had this unique opportunity as a country around rethinking, redoing our crisis system so it's more responsive and healing. And, you know, unfortunately, on July 17th, the federal government defunded the LGBTQI youth line. And we know these youth are really at high risk for suicide, 4 times higher than their peers. And I think we have an opportunity, and we are coming together at the state and local level to really see, you know, how can we train up all our 988 workers? How do we create something, maybe in partnership with the Trevor Project, to really prioritize these services with the fee that we passed? Fortunately, Washington has been in a great position to be able to really fund a lot of this work. And so that's one example of how we can be jumping in. Our state has done a lot around Washington, Keep Washington Working, which again is making sure that our National Guard and our police are working within our communities to keep people safe. So these are some of the key pieces, but it really is going to take partnership at every level. And I always say I can drop the perfect bill, but it's really the stories and the people that move legislation. And so this will be a team effort as we go into next session.
Great. Thanks, Senator. Who'd like to go next?
I could go.
Joe.
My specific various role as a frontline case manager, I would say that I know that when the cuts come in and we have the resources are going to be very difficult to navigate. So in my position, I'm going to have to build a lot of better partnerships, better bridges with providers to make sure that my participants, the clients that we work with, can actually access the care, because it's going to be considerably more difficult to access. I think that's going to be a most important thing. I love what Malika said about being hyper local. I told this story earlier, but this 2 weeks ago, I went on a giant hike and I noticed there's garbage everywhere. Why is there garbage everywhere on the hike? Because they cut the funding for the hike. So you know what I did? I cleaned up as I went. I did hyper local. I did what was right in front of me. I took care of what I can take care of. Of course, that's just a drop in the ocean. But for me, as someone deep down in my soul, that's what I'm going to do for myself. I'm just going to make sure that I serve those that are right in front of me. Also, confronting any xenophobia used by those implementing and defending harmful policies is something I'm going to choose to do by serving on boards, by serving on advisory groups, and by doing roundtables like this.
Excellent. Thanks, Joe.
David, agree totally with what Senator Orwall and Joe have said. See something, say something, right? But in a positive way. Find the problems, gravitate towards those problems, and organize around them and advocate around them. And let people use your privilege that you have in your lived experience to advocate to those who are making the decisions and allocating resources, whether that be, so walking that walk like Joe just talked about, as well as advocating to folks at your local level, joining boards, as Joe suggested, finding those organizations that are like-minded with you to build that community, to build those bonds stronger at the local level so they can resist the next 3.5 years of firestorm, because that's what we're in for, unfortunately. And so how can we, as a neighborhood, community, state, come together? So those are things that I'm doing, as well as politely but firmly talking to positions and to folks in positions of power about what my expectations are. Again, how do you prioritize those folks that are in the greatest need, and both advocating strongly and holding people accountable when you feel that decisions are made in ways that are suboptimal, let us say. So at your community level, at your city level, with state government, and with your federal representatives. And things I hear from folks who are in elected positions is they need our backup, right? They hear a lot from the haters, right? And so they also need to hear both attaboys, attagirls, as well as here's what I need you to do, and what I would like you to do, so that they have that cover as well as that direction, because they want to be representative, just as it says in their title.
Excellent. Thanks, Nick.
So this is Malika. One of the things that I'm definitely doing, as Joe mentioned, and some of the other folks, making sure that all the organizations that I'm on the board of have a strong fundraising component, and also advocating within my community to support the work that is occurring, and putting our dollars, our personal dollars, where our belief systems are.
Nice.
And also I think that I appreciate that, and I'm not saying this because like I'm condoning just being blatantly disrespectful to folks. However, I think that we need to not be afraid to speak up in ways and speak directly to the issues. Because if we're very concerned with creating the unpleasant sandwich, as it's sometimes billed as, that you put the bad thing between two positive things, it can dampen what the real circumstances are on the ground for the people that we're working to advocate for. And we need to be very, in my opinion, willing to speak the real truth and speak truth to power, and also continue to hold their feet to the fire. I appreciate that oftentimes people say that the folks that are maybe potentially against the things that we are advocating for in this particular circle They hear from those folks and they don't hear so much from us. I've seen it in real life that that's not the case, and it feels very much like oftentimes it's easy to throw the nice people under the bus. And I think that we need to own our power and show up. And in the spirit of ACT UP, we are not going to take it. We are not going to be okay with our folks and our values not being represented by the people that we elect into office. And I hope that doesn't sound too confrontational. Actually, it's okay if it sounds confrontational because I mean it that way. I don't mean it in a blatantly disrespectful way, but we need to own our power. And we also need to not count on government to come and save us. We need to be able to develop the supports and support the local organizations that are in our communities doing the work that we believe in, because the funding that they have had in the past is gone. Our YWCA in Olympia, Washington, the grants that we typically get to support women, we don't get anymore. We were going to have to go under like dormant, but we decided that's not okay. We're going to do everything, like from the working board to the one executive director that we have left and to the rest of the community. We are going to continue in the mission of fighting against racism and empowering women. And I think that we all need to take that stance in our communities. It's not always just money, it's about time and commitment.
Thank you, Malika. Well said. Cathy.
Yeah, just two things. I think now is the time to really build larger coalitions. We have to all be on the same page. We can't be fighting. It's really easy for smaller organizations to fight for their one thing, but we all need to be together and fight for everybody that's being impacted. So building those relationships with other, again, I think Nick said, like-minded organizations and having those larger coalitions is going to be super important. The other thing I've been thinking about is, with great trouble comes opportunity. And to take a step back, what are the things that we hate about our system that we could do differently at this moment? Because we have less money and we have to think creatively. So we have to lean into our creative juices to say, hey, is there a better way? Could we strip out a lot of the bureaucracy so that it works better for people? And then that in turn saves money in the long run, right? So I think we have to lean into those things.
Great. Thank you, Cathy. Let's move on to the third question. What recommendations do you have for others in our collective efforts to survive the next 4 years and to protect those who are most at risk from the actions of the current national administration? Don't everybody jump at once.
I can jump in. Thank you, David.
Please.
I think so much has been said already. I always say, do you know who your legislator is? Do you know who your city council? Do you know your board members? Have you reached out? Have you had coffee? Because we work for you, right? And one of my favorite quotes is Alice Walker, who's a famous novelist and advocate, and she did The Color Purple. And her quote is, the most common way people give up their power is thinking they don't have any. There is so much power that you have at every level of government, and we are government, right? We are shaping policy. And again, I just really appreciate, let's build better. Let's find those resources. Let's do it collectively. And again, I think everyone here has a key role in that.
Thank you, Tina. Senator, sorry. Tina and I go way back. We go way back. She was actually, you were a social work intern for me when I was working for King County.
Greatest boss ever.
Oh, I don't know about that.
Hey, take the compliments where you can get them.
Okay.
David.
All right.
So just to add, I'm kind of a broken record on this, but organize, bring people together and advocate at every level, as Joe talked about. Advocate at the local level, advocate with your neighbors for criminy sake, right? And to Cathy's point, the opposition wants to divide us. And so they can literally divide and conquer. That's the fascist playbook. It's not the F word I usually use, but it's you know it's clear what's happening in this country, and again, organize and advocate to be a better alternative. Find people who are like-minded, and to Malika's earlier point, make people uncomfortable. Not so much so that you get dismissed as a crank or that or as somebody who's on the fringe, but the more people you have that are together talking about lived experience, the more people you have together talking about what your community's needs are, the harder it is to avoid your message. Join those organizations like NAMI, like the ARC, like Washington Low Income Housing Alliance, like so many Children's Alliance, right? There's lots of organizations advocating for the disenfranchised. Find out who they are and what they are, and get active in that, because that's where you'll find some of your people to be able to have more of an impact and amplify your voice. And again, keep speaking about to prevent the normalization of what's happening, disenfranchising and systematically attacking the most vulnerable in our community. To uplift, that's how we uplift our values, is with those direct actions, speaking truth to power, as you've already heard, and just being visible as hell, so that you can't be discounted.
Thank you, Nick.
In the spirit of, I guess, making people, oops, sorry, did I interrupt somebody? I'm sorry.
No, go ahead, Malika.
Okay. In the spirit of probably making some people uncomfortable, not on purpose, but I think that we also need to examine our movements when we say that you want to bring people together, but frankly, within a lot of our, the broader movements that have a lot of social traction with legislatures and with electeds, oftentimes the same issues that we experience in society broadly, such as, sexism, racism, classism, all of these different issues. I'm going to say it. Sometimes we don't do a very good job of addressing those within our own movements, and we still leave people out. And so I feel like hopefully this is the time that we can learn once and for all that we need to really work on those issues, and we need to build really meaningful relationships that are not just for the moment and that don't just tokenize folks. That because tokenization is a form of discrimination. We need to make sure that we are being inclusive, really inclusive, and really listening to what people, the issues that they're experiencing, because even within the most marginalized, that's not just like a uniform group of people. It looks different depending on what part of our stratified society you come from.
Mm-hmm.
And so I challenge us to really examine ourselves so that we truly can move forward as a unified front and stay unified beyond the current challenge, because there will be others to come.
There will. Thank you, Malika.
David, if I could just build on that, I love
Please.
what Malika just said. I really think that we have got to focus on influencing thought, collective thought. And when I'm not yet 3 years into this work, but I said from the jump, anyone who wants to talk to me, I will speak to. And I have kept that commitment with the press, with the public, because if somebody's further from me, philosophically, I'd prefer to influence that person. We're in a space that should not be political. When you think about mental health, behavioral health, the human suffering. And I find that there's these extreme perspectives all around the country, and they're just not quite right. It's not true that law and order solves this, and it's also not true that we should just leave folks to self-determine their way out of things that are really complex. And so I just really encourage debate and candor. And I agree with Malika. I don't equivocate on my perspectives. I'm really willing to provide counterpoint, but we have to have the conversations. We cannot be in these echo chambers, because we're getting more ignorant when we do that.
Thank you, Amy.
I can go next. I don't like ever following Chief Barden, but I can try. Community over politics. That's what it's about. We all talked about it. Mutual aid, peer recovery, grassroots support. How do we get hyper local? Encourage those with a lived experience, those who are marginalized, to have those positions, to speak up, to testify, to vote, to speak out, to go to the state legislature and talk to Tina Orwall and talk to all those different make sure that we center our systems around the people who are the most marginalized and who are the most vulnerable. And someone with lived experience and someone in that community itself is, encouraging others to do so, because I think a lot of times we don't feel like we have power. We don't feel like we have a voice, and we feel like we don't have a place to actually speak up. So I think encouraging that is going to be something that's going to be important for my collective effort.
Thank you, Joe.
Can I jump in? I'm
Sure.
in the corner there with my little hand raised.
Yes.
I'm Peggy Needham. I live in Walla Walla, Washington, in a small rural community. I've worked with Malika, I've worked with Tina, and in our community, we're down to one hospital. We just had another social service agency recovery community fold as of last week. We a long time ago have decided that we have to at times depend on our community. We can't necessarily depend on outside. And so one of our other agencies, Blue Mountain Heart to Heart, who I worked for, is looking at trying to help absorb some of the lost of Trilogy. So I think sometimes when we look outside the box, that's great. But what we have control over is what we have inside our box. And our communities can give us more strength if we can present the case of why we need the help. And so we have seen our homeless community shelters grow because we needed it. We need people, we need to have a safe place for people to go. We have seen a community paramedicine program that involves an RN and a social worker and a paramedic that is out on the streets every day. So those are things that our community has funded, most of it locally, by, coming together. So while we look at other outside funding sources, we have been able to survive, and I want to say not thrive, but maintain, because of the commitment within our own community. So I just feel blessed for that. So, our churches have stepped up. They're housing our Christian Aid homeless men's shelter that's being rebuilt. So they have absorbed that. I think, people just may not know how to help. So we have to make sure and clear of what the need is. So.
Thank you, Peggy.
David, there are a couple of comments in chat that we might want to touch on.
Okay.
Around Ivanova, Smith raised some issues around services for people with intellectual disabilities. Cathy, I don't know if you want to take that, as well as quote, ugly laws returning based on what the current president has called for in terms of involuntary commitment. Anyone can really take up those, that particular one as well. It kind of moves us into the final question.
It does.
If you want to just mention that question now, and then maybe people could touch on those questions that Ivanova has placed in the chat.
Sure. Yeah, the final question is, what do you see as the major issues that will impact Washington State coming from Washington, D.C.? Who'd like to go first?
I can touch on, Ivanova's comment and the concerns there. I think, we already don't have enough access to outpatient mental health services for people with IDD. So now the concern is what we have will disappear. And right now we need to be strengthening that. So that's a real concern. And I think the next piece about the fear of returning to ugly laws, I think, I think that's a real if you don't know what that is, it's when they kind of just eliminated people that they didn't like how they looked. And people with intellectual disabilities were often just taken, put away. And I think that's a real concern, that we will head back to a model of institutionalization, that people will be, put away again. And those are real concerns, and away from community base. I'm afraid other things I'm worried about is that suddenly we're going to have wait lists for services again, that we're going to lose our provider networks, and mostly that just people are going to fall through the cracks. How are we going to, that there will be no support network. So I think we just have to continue to build our networks and make sure that we help people to find these natural supports in the community.
Senator?
Thank you. And I really appreciate those comments. And I guess I'll take the one on different laws that get introduced. As legislators, we can drop and have staff write bills on a variety of topics. But there is a difference between introducing some of those bills and them having hearings and moving. And I feel like our state's done a really good job protecting things that we think would impact communities in a harmful way. I think there's been a lot of dialogue about how do we create a better outpatient, how do we do more supported housing versus detainment. But I think the conversations are happening now. I know a lot of members are working with the community, like myself, to have those conversations of where that balance is. At the beginning of the hour, when we were starting, we were talking about all the housing with services coming on site. And I have two big projects in my district that give me hope. One was the Arc of King County with Mercy. The other is Open Doors, which is a multicultural agency opening up a huge housing with Mercy that's going to have culturally competent daycare. And it's going to have spaces for families with children with intellectual and developmental disabilities. And so we have to keep building. We have to keep it expanding. And we're going into a tough budget session. I'm going to look at Nick. And we have to prioritize our funding for those most in need and for those most impacted. And we're going to need a lot of help from the community to move this forward.
Thanks, Senator.
I think that when we speak about the reinstitutionalization of people and we're blaming it on Washington, D.C., frankly, Washington State has had a lot of rumblings of this sort of movement for quite some time. And it is gaining traction with folks that are within our legislature in Washington State from both parties. And I think that we need to be very vigilant about our advocacy that if that is an option, that it is the absolute last option that is implemented or instituted. And it is very concerning to me that some of the language that I have heard around the state or from folks that represent different places around the state that think that is potentially the way that we need to increase, especially for people that use drugs. And instead of being able to have more community-based care, we don't have anything occurring in Washington State that is to the scale of the need. And that's not a criticism, it's just an observation of the reality. And we need to be, to Senator Orwall's comment earlier, we need to be very vigilant and aware of what are the best places for us to make these investments with our very limited resources, and make sure that we are not targeting vulnerable people to be institutionalized, and when that is not necessarily the circumstance that is going to improve their condition. And so I really hope that all of us across all of our movements can work together to be ready to advocate when this next session comes.
Thank you, Malika.
Yeah, I just want to confirm what Malika just said. I think that the extremes continue to harm us, right? We just do not have an appropriate continuum of care for folks to be able to right size basically the intervention. And in my prior career, I had talked all the time about how we knew asylums were terrible. We did. So we closed them, we promised community-based resources, and we did not invest adequately, and we still are not. And so I think everybody that I know in recovery, especially people who have been mixed up in the justice system, they did need an intervention. But I often hear, if you get healthy, basically in the context of jails or prisons or institutions, it's often in spite of them. With prisons and jails, it's always in spite of them, not because of them. And my contention is we could change that tomorrow in Washington state. There is no reason our jails and prisons are what they are, but it has not been a financial priority. And I don't know I'm not in those conversations. I don't know the role of labor and other interests, but it has to change because we're compounding trauma. Again, I run 911, then I am watching this rinse and repeat of reverse overdose or jail someone for 24 hours. And they're not only are they right back to the same circumstances, but generally they're worse off. And if we would just focus on that issue alone, I think we would see a difference in our communities.
Thank you, Amy.
I'll just add, I think it's important to think about this in community circumstances and to not politicize stuff, but all of this is political, right? And everything is political. And we are seeing, I think Dr. Barden used the term weaponization, and indeed the militarization of government services, right? And again, at the local level, at the state level, we need to resist that and provide those better alternatives that, because Washington State isn't perfect. We do better than a lot of folks in a lot of ways, but we can always do better. And so adopting those policies, the inclusiveness that Malika was talking about, the better ways of delivering care and just caring about people that Dr. Barden was talking about is important. I think we're going to see more of the same from the federal level, starving programs that some people don't care about, militarizing and weaponizing some of the interventions and interactions, right? The proposal to incarcerate folks who are chronically homeless, which, as Dr. Barden was saying, is both the least effective, re-traumatizing, and by far the most expensive way to deal with this. But some people just don't care, right? Because it's we're dealing with a pretty healthy dose of toxic masculinity here that doesn't care about trauma. Or even recognize that it exists. And so, again, I think that's what we have to expect. And therefore, as everybody has said, we need to lean into doing and being better and advocating for the folks that in scarce financial circumstances of governments, what can we do both individually as well as collectively to move the needle to a better place, but first keep the needle from continuing to sink into the abyss.
Thank you, Nick.
As the panelists were speaking about, I think we're talking about criminalization over care, that becoming a major issue. I was honestly thinking about the days I woke up in jail, dope sick, the days that I would wake up on the sidewalk after being Narcaned over an overdose and then being placed in handcuffs. So, just common sense and kindness and compassion, right? Mixed with, it doesn't mean compassion and kindness doesn't mean accountability. There's a lot of different aspects that kind of what I consider the health of my recovery and kind of all the things incorporate that, but thinking about what everyone was saying too, the other major issues, as we were talking about with the last question coming from Washington, D.C. This last weekend, I spent 14 hours driving. What was I doing driving? I had to drive to a small town in Eastern Washington to pick up my mom. My mom's disabled. She has significant mental health disorders. She cannot basically live on her own. I had to pick her up from a small town in Eastern Washington because there's no services over there that can actually care for her and that she needs a major, major surgery coming down the line. So I had to go pick her up, drive her back over here to Seattle where there is access to those care, where there is access to those services so that she can get the care that she needs. If these services are cut, I can see my mom becoming unhoused or going to a nursing home. I don't know what there is to do. I don't have the resources to support her. In the last 2 weeks, I have lost 2 people to overdose. As if we keep these cuts, we keep seeing that the federal government is cutting funds to Narcan, to first responders. We're going to see more people die. I think death is the worst thing we're going to see from these policies that are hitting. We're going to continue to see my brothers and sisters, my friends, and my family members die from substance use disorder, from opiate use disorder, and we just can't allow that to happen. We just cannot allow that to happen.
Thank you, Joe.
Absolutely right. And I think that is a little bit of a segue to a point made in the chat from someone representing Spokane County. I'm assuming you mean by that, Rebecca, that you're living in Spokane, or are you an elected official representing Spokane County? Did you want to speak up about the point you raised in the chat? Rebecca Smith. Okay, maybe she had to go off. Well, it still is a legitimate point to raise here, which is basically looking at how we're kind of, quote, setting people up when we think that they're on the road to recovery, but even something as simple as an apartment placement can create, kind of a secondary horror around substance use disorder, that people sometimes are placed in really awkward places to recover, and they're in anything but a therapeutic environment. So this just goes a little bit to what some of each of you have been talking about around this nonsensical nature, in a way, of our systems. Sometimes they don't reveal themselves until we see a crisis. But does anyone want to mention anything on this particular point in chat?
Yeah, I can respond to that and just validate that as an issue all around the state. I get calls just personally all the time. You know, my daughter is in recovery. She cannot go back to this environment. You know, she just, therapeutic courts are very successful around the state. And I actually think this is the challenge that's the hardest to design for, right? That especially if we have decades-long cycles, you really need to be part of a community that will support you into this next season. And Joe Barsana, actually, I quote all the time, one of the many things he's taught me is that recovery is really about not sobriety, but connection to purpose. And again, the government is not going to design that, right? But we need to make sure that we make investments that support that philosophy.
Thank you.
And thank you, Rebecca. She added a couple of additional points in chat related. And happy that you're here representing Spokane. That's wonderful.
And I think
the
these are,
barrier. I'm sorry.
no, sorry, Laura. I was just going to say, I think these are excellent points. And I feel like we're starting to move our system in the right direction, but there is a lot more work ahead. I think about the crisis release centers, and we have one in Kirkland, and they really need to be throughout the state, but they are alternatives, right, for people going to jail or emergency departments. And we have a long history of boarding people in emergency departments, people going to jail, and we know that there are much more healing and humane services that we need to be setting up. And so, again, I think we have these visions, but we do need the resources to operate them. And again, I think there's a roadmap if we're working together and we're really having people with lived experience leading the way.
Thank you, Senator.
Laura,
you want to open it up now for?
Yeah, I think that makes a lot of sense. I allowed about 20, 25 minutes, maybe, whatever we have left for open dialogue. And actually, when I brought our speakers together, I was thinking of the dining room table with each of you sitting at the table and getting the floor on each of you, and maybe having some more dynamic discussion. So we got there a little bit, but everyone has a view. So I hope that you can continue to raise your voices in this next phase of the dialogue. Are there any particular questions that people have? If you want to just raise your hand, and that button is under the React section of the Zoom toolbar at the bottom of your screen. I noticed Matthew Goldman called in, and not to put you on the spot, but did you want to mention anything, Matthew, about crisis care centers and where things are, and maybe where you see some of that fits in this discussion? There you are.
Hi, I'm happy to chime in briefly. It's great to see you all, and thanks for the discussion. Learning lots from you all, as always. Yeah, so hi, Matt Goldman, he, him pronouns. I'm with King County Behavioral Health and Recovery Division. I'm the crisis medical director for the county, and we are fortunate in King County to have robust investments thanks to our county population approving things like the Crisis Care Center levy a couple years ago, which is investing $1.25 billion into expanding and really building a crisis system at capacity for the 2.4 million residents of King County. So this is a 9-year levy. We are in year 2, 2024 to 2032 is the stretch of the levy. We are primarily focused on building 5 crisis care centers across the county, including 4 that are regionally located across the county, and then 1 that'll be dedicated to serving youth. We have 1 center that's open and operating in Kirkland in the North region, and we are working intensely on trying to get the other ones up and running across the rest of the county. There are current efforts to secure a location for our crisis care center in the central region in the city of Seattle. And we're also working on reviewing proposals for other parts of the county. And so all of that work is ongoing. The levy also invests in expanding our mobile crisis services, both for adults and youth, and we've significantly expanded the capacity of those programs. We are also investing in 911 diversion programs. This is something that Amy's familiar with, trying to expand a Department of Health initiative that started as a pilot funded by the state, but the county is investing local resources to expand this locally, to work with our crisis care, our crisis call center. So used to saying crisis care center, our crisis call center, Crisis Connections, which receives 988 calls and also the regional crisis line calls, coordinating between them and our local 911 public safety answering points to try to divert appropriate behavioral health calls from what might have otherwise been a law enforcement response if you don't have Amy's care teams around to handle those calls, to instead receive a behavioral health specialty response through the 988 call center and potentially dispatching mobile teams. And so anyways, there's a big workforce investment, also expanding our residential treatment capacity. Lots more I could say about that. But yeah, I think reason for sharing all of that, Laura, sort of reading between the lines for why it's relevant to this discussion, is local investments matter. We are so fortunate in King County to have these resources from the levy and also from our local mid-sales tax, and also funds that have been provided from state provisos and other activities that make it so that while yes, there are we're anticipating tremendous impacts on our Medicaid funding, on other federal funding sources, it's generally just a very challenging environment. We're very fortunate to have these local resources to still do the work with community partners, really center equity in the work that we're doing, and focus on expanding access to care, and yeah, do as much as we can with the local resources that we have available. So hopefully that was responsive, Laura, to your question.
Thank you, Matthew. Yeah.
Well, one thing that you did mention, you said very briefly that a program that was a pilot is now rolled into becoming an actual service. And I think that that's really important. We sometimes have pilot projects and we never find out whatever happened. Good or bad, there could be a pilot that doesn't go particularly well, but with a little bit of, support, can actually become a service. So I'm happy to hear, I forget which program you were mentioning there, but thank you for adding that. And also that the crisis services really, in my view, kind of are going to drive systemically some of the other resources that we do need. I think housing is going to become a big program that we're going to really need to focus on out of crisis services. People finding support and service, but basically needing a place to live ultimately. So hopefully some of that will appear as time goes on. But thank you for the overview. It's a big part of our system now, especially in King County. So I appreciate that you're here. There were a couple of other things in chat too. I think Oh, Jean Alderks, just wanted to shout out for Northern King County cities that have built a crisis continuum of care and that they're continuing to improve those partnerships and fan out to additional issues and stakeholders in Northern King County. Thank you, Jean. Did you want to add anything off mic or off mute?
Sure. This is Jenny Alderks, and
I'm sorry, Jenny.
it's okay. Jenny with an E. It's been really great to see the work that North King County cities have been doing, and that also extends into Snohomish County. Snohomish County is actually about to completely build out their crisis continuum of care with 2 stabilization centers that will be opening later this year in Linwood and in Everett. And so that's a really important piece of making sure that people can get through challenging times. But my biggest concern is always, how do we keep people connected to their treatment plans? Because, you know, we have the best intentions as we release people from emergency care, but those treatment plans are needing community care to make them happen and to do that follow through. And so that's why I was asking about, you know, universal healthcare options as well, because that is the type of accessibility that we need to really save people's lives. I lost my mom because we couldn't afford the medical care and the mental health care that she needed, and she died by suicide in 2022. So it really matters to me when we're talking about referring people into the community. There has to be affordable, accessible care. Thank you.
Thank you so much for being a part of this discussion today, and continuing to educate us along the path. Nancy, did you want to add something here?
Yes. I wanted to share a good news thing. The regular meeting of the King County Behavioral Health Advisory Board happened in less than a week after Trump's big, beautiful bill passed. Not that I'm calling it that, but, and it came up in the board meeting in, I think, a really effective way. Susan McLaughlin, the head of Behavioral Health Recovery Division, described a lot of the impact of that bill as death by 1,000 paper cuts. And she went on to explain that what has some of the things that have happened with Medicaid are requiring people to re-enroll every 6 months instead of a year, and requiring a lot of onerous documentation and verification to stay on Medicaid. And she said, it's, you know, all of these things are doable if people have the right supports. And so as a board, we discussed different ways that we could provide efforts to support people to help them navigate this new bureaucracy that has been imposed as the way to get people off Medicaid, that people can be kept on if they have the right supports, if when they receive the letter making these requests for re-enrollment and verification, that they have people that can help them. So that's something that very early on, very locally, we talked about being able to kind of counteract some of the things where the bill has been designed to sort of get people off by an accelerated sort of attrition that we really do have the ability to counteract. The other thing I wanted to say is also through the board, I had the opportunity to tour the Crisis Connections facility in Kirkland, and I was very, very impressed with the facility that I saw, that the work that's being done to try and help people when they discharge so they aren't just going out unsupported. And I was really impressed by what I saw at the center. Thank you.
Thanks, Nancy.
Yeah, really appreciate your perspective, Nancy. And you've been leading the Behavioral Health Advisory Board for many years. So your perspective is particularly appreciated, especially in light of the roundtable in terms of, people who are expert in the areas that they're working in now transferring what you know and your know-how to younger generation who are coming up, and helping to lead our systems today. So you're a role model for kind of the roundtable,
Thank you
focus.
for that. And I am finally reaching the end of my tenure in that role. We will be having elections in November, and in January we will have a new chair of the advisory board.
Okay, wonderful. We'll have a really excellent farewell party. Get a really nice cake. Any other comments? There's some great things happening in the chat as well. Let me see, Tasneen, really wonderful perspective here. Great, yes, the role of community engagement. There's a community engagement partner as well working with the crisis care levy, and her name is Ida Belfassi. It'd be great if you don't know her already to reach out. You may already, given that you're working in Kirkland. An excellent point about open door, including people who don't have insurance. You're right, or have crisis coverage issues. I personally, I'll say, use the crisis care system when I had a crisis. And one thing that happened that I was really afraid of was the impact of any billing I might receive afterwards. And I held my breath. I was anticipating, yes, I'm going to get billed for ambulance, and I was actually able to negotiate with the company to lower that fee, but I still had to pay a substantial fee for a very short ambulance ride. The rest of it, believe it or not, was actually covered through the insurance I have. So I was grateful, but it also, I got the bill that said, this is not a bill, but this is what the charges are. So I was very pleased that nothing else came of that in terms of financing, but that is a real issue for people. And I'm sure that the system will be looking at the variety of issues that people run up against when they use any kind of mental health services nowadays. So did you want to add more to your remark, Tasneen?
I would like to, especially in that context, Sergeant Sullivan, David Sullivan, in Seattle, him and I had an extensive conversation when I was with Connections, and we had that very fear, Laura. And that is one of the reasons we determined was why Seattle was not bringing our, needed folks into Kirkland, which is absolutely relevant. And it is a fear. While Connections was able to, manage the billing on the services side, we know that, AMRs and, TriMet and them, they're not going to be able to do that, right? So I don't know where that conversation left off, but I am very interested to know. Because I'm also working with a family right now in Federal Way who is experiencing exactly this. Transportation is a barrier, but they can absolutely benefit from the services up here on the east side. So where do we go? And I know Sound has done, they've done a robust system out there with, medical transportation. But again, we're running into the different zip codes, we're running into the different regions. And that is something that's extremely, hurtful to our communities and those who need to be in the spaces that they're not able to be in. And so I'm happy to take these conversations. And I know Senator Orwall, a lot of you guys know me, and you guys know I'm always going to advocate for this because I am a suicide survivor myself, as well as a DV survivor. And today, years later, I have a voice and I'm going to use it. So I absolutely love what we're able to do here. And with Lightheart Mental Health, I'm actually the regional outreach manager now. And I cover all all the way from Bothell down to Tacoma, the whole 405 167 corridor. And like I said in the chat, we are now in network with Molina, with United Healthcare Plan of Washington, and soon with CHPW. So while we have this, guys, please reach out so we can make sure that our folks are being taken care of with outpatient therapy and med management, and where else we can get them. That's all I wanted to say.
Thank you, Tasman.
Yeah,
Absolutely.
Thank you so
Senator, I
much.
see your hand up.
Yes, and Tasman, you are an incredible advocate. Thank you. And you've raised one of the issues that has come up, which is around the transportation. I know we put in $1 million of our 988 fee to buy 988 vans to actually start linking those with outreach teams so that there is more opportunities for transportation. Jenny, I want to say how sorry I am that your mom didn't receive the services she needed and deserved. I'm so sorry. And there is a lot of conversations about integrated care, collaborative care, especially when we know we could be seeing significant Medicaid cuts. Our state actually is probably one of the most leveraged states for Medicaid, but it is an opportunity to rethink our system in a way that is much more integrated and collaborative and really treats someone as a whole person, knowing that there are a lot of needs. The other shout out I will do is Representative Cody, who retired, did a lot of work around ensuring insurance companies cover the cost of crisis services, which is so important. And again, we're looking at next day appointments. But again, I think the forums like this are just so important that we can say what's next, right? What are the things that Washington should be doing, and knowing that we have the voices and resource commitments to make those happen.
Thank you, Senator. Laura, do you want to close us out?
Yeah, I think we're just about ready to conclude. We figured adding a 15-minute break there at the end gives more opportunity for public comment. And I really hope that people, if you did not get your questions addressed, I did add my email into the chat, and I'll put it in again because it was actually a response to someone's question. So. But feel free to email me. I really, even just at the very end of this program, I can see that we have some great topics for future roundtables. The whole issue of financing and the requirements that people are going to need to address, both the systemic requirements as well as the patient issues that will arise. I did see Ivanova, I believe, brought up the issue of person-centered planning, and all of these issues are really excellent fodder for future meetings. This was the first time really focused again on our state and our communities. I like that, and I think if I'm going to do a roundtable, I should do at least one every quarter, maybe on what's happening in Washington. There are plenty of people that like to speak. So we can do that if David, if you'd be willing. I want to thank everyone for just showing up. This is a way to keep the wheel turning, and hopefully we'll see people on LinkedIn and Facebook. I want to acknowledge Carly Campbell, who will be and has recorded this meeting up until the very last moment. And she'll be helping me to get this rolled out to the community. So I'll keep an eye on where that goes and make sure that people do get the link. It'll probably appear on YouTube, which is great resources for us. And previous roundtables are located at the channel that I've created. So that'll be a great place to look at previous episodes that we've had. Thank you, everyone, and hope everyone has a great day, and take good care.